my name is Mustafa. I come from Rotterdam and I'm here on this minor.
My name is Lina. I also study at Rotterdam Erasmus University.
Hello, my name is Mehmet and I'm also studying in Rotterdam.
Hello, my name is Gulut and I also study in Rotterdam.
Currently we are in Jakarta for a minor global health and we did an internship for 6 weeks at this faculty at the RSGM hospital, and through this video we'll be taking you through the departments that we visited. So like we just mentioned, we did our internship for our minor global health in Jakarta, Indonesia. We spent most of the time of our internship at the Faculty of Medicine of the University of Indonesia, which is connected to a university hospital. The university hospital that the Faculty of Medicine of the University of Indonesia is connected to is called Rumah Sakit Cipto Mangunkusumo, named after Cipto Mangunkusumo. One of the departments that we visited was the ophthalmology department, and this department actually was separated from the main building, so to get to this department we had to take a different route. During the part of our internship that we spent at the ophthalmology department, we got a couple of lectures that taught us about common eye conditions in Indonesia, and we also got matched to a couple of residents, and together with them we could see a couple of patients in which we could ask questions about these patients and they would explain the conditions of these patients. And during these visits we saw a couple of very interesting cases that you would not normally see in the Netherlands. For example, people with very severe eye conditions that have never been to a hospital before. A couple of conditions that these patients suffered from were actually common infectious diseases in Indonesia, for example HIV and tuberculosis. At this department also worked an ophthalmologist who used to be a barista before he became a doctor, so a couple of times he made us a great coffee to enjoy. Another department that we visited was the pediatrics department, and a thing that was characteristic about the pediatrics department were the Disney-themed walls, to make a hospital visit more comfortable and less scary for the children. Most of our activities at the pediatrics department consisted of being assigned to residents, where we could see patients together with them and ask questions about them, and at this department we also visited the ICU. At the endocrinology department we mostly saw cases of people with diabetes, type 1 or type 2, and we saw people with thyroid problems. At this department we also had a conversation with Dr. Dickey about reimagining global health. After having spent a couple of weeks at the hospital, we were warmly welcomed by the people of Jakarta and to their puskesmas.
From Leiden University and Erasmus University. Welcome to Posyandu, Pemalang.
After being warmly welcomed into the puskesmas by the people, we were informed about all kinds of activities that they did there. For example, the basic health checkups that they performed there, and also the physical activities that they performed for the people to stay fit. Outside of the physical programs, there were also programs designed to maintain a good mental health. These programs included harvesting their own crops and producing their own products, which they can later sell at the puskesmas. After visiting the community health centers, we did a couple of home visits in which people let us into their homes to see what their living conditions were like. During our visit to the Mekara clinic, we got a tour around the clinic, and we also had a conversation with the head doctor about reimagining global health, just like we did with Dr. Dickey. After visiting a couple of other institutes, we made our way back to the Cipto hospital in which we visited the cardiology department. Here we got to see both the ICU of the adults and the children. We also visited the endoscopic center, in which we could attend a couple of endoscopical procedures. A lot of these patients had suspected colon cancer or gastric cancer, or cancer somewhere else along the GI tract. Lastly, we also visited one of the newest buildings of this university, the Research Institute. This building also contains a museum that showcases the history of both the hospital and the university. And that were all the departments and institutes that we visited in a nutshell. Okay, everybody say bye! Bye!